Today we're going to talk about epithelioid sarcoma and what it looks like under the microscope. But before we begin, thank you to this article by Leon Alexander about epithelioid sarcoma regarding the clinical features. Usually it presents as it's a soft tissue cancer in the distal extremities, usually the hands and fingers. And they're usually seen in young adults. This patient in particular was 18 years old. And you can see the tumor on the fourth digit right there. And here's an x-ray. As you can see, it's not a tumor of the bone, but it's around the bone in the soft tissue. And here's an MRI showing that's enlargement of the soft tissue right here. So this is a different case, but thank you to Path Library. Usually I try to do this blind, but I already looked at the answer. But from afar, you can see like a granuloma with necrosis. Actually, you don't know if it's necrosis. It can look red. It's red. We know that. So this could be like a rheumatoid nodule where it's like fibrin. But if we look closer, you can see it's necrotic because it's got the outlines of cells of that have died. So that is necrosis. Another differential, and one that can, if you call it, and it's actually epithelioid sarcoma, can get you a lawsuit, is granuloma annulare. Granuloma annulare also has this granuloma look, where you have this palisading look, and it's also kind of, the center looks acellular, but it's not necrosis, it's kind of dermal mucin. But in this case, it's necrosis. And a hint to differentiate like rheumatoid nodule and granuloma annulare from epithelioid sarcoma is look at these cells. They're pretty atypical. The cells in epithelioid sarcoma will be atypical. There will be mites. For instance, compare this, I think this is a plasma cell, to this cell. Look how larger this cell is. You can fit 3 of these cells. You won't see that in granuloma annulare or rheumatoid nodule. So I say this to emphasize the point that because it's so important, because you don't want to give the patient a benign diagnosis, because which rheumatoid nodule and granuloma annulare are. But epithelioid sarcoma has a bad prognosis. It's pretty aggressive. One study I was reading is 5, and it depends on when it's found, but 5-year survival rate was around like 50 to 70%. And this is a patient who's, the patient population for those with epithelioid sarcoma is pretty young, so they have still a lot of years left. So you don't want to miss this, is my point. So when you see necrosis in this palisading distribution, what I mean by palisading is like the cells are kind of organized concentrically around this necrosis, like here. You see all the cells kind of organizing peripherally. That's what I mean by palisading. Think epithelioid sarcoma. Okay. And if you're not sure of how to diagnose epithelioid sarcoma, or if you're not sure if it is epithelioid sarcoma, and most of the times, we won't make it histologically, you can get you can get IHC stain. So epithelioid sarcoma will lose INI1 protein due to a SMARCB1 mutation. So if you get an INI IHC, normal should be INI retained. But if you get an INI1 and it's lost, that's good for epithelioid sarcoma. Here, I'm not 100% sure that this is like the cancer in a lymph node, or if it's just a solid tumor of epithelioid sarcoma, or if this is just a reactive lymph node, to be honest. Maybe this is the early stages of epithelioid sarcoma before it outgrows its blood supply and there's necrosis. But typically for epithelioid sarcoma, you'll have this necrotizing granuloma with atypical cells that are palisading. What else was I going to say? Oh yeah, so this is a soft tissue cancer, and there are several soft tissue cancers that metastasize to the lymph node, including epithelioid sarcoma. The mnemonics is RACES, RACES. So R is for rhabdomyosarcoma, A is for angiosarcoma, C is for clear cell sarcoma, E is for epithelioid sarcoma, and S is for synovial sarcoma. All right, well, that's it for today. I'll see y'all another time.